I am Dr. Harish, NS, consultant, laparoscopic surgeon and surgical gastroenterologist. I am the founder and director of IMAS. What is diabetic food? As you know, diabetes mellitus is one of the epidemic disease today. Each and every individual are suffering from complications. Since I am a surgeon, I am going to talk about a surgical complication of diabetes mellitus. When will the patient have a complication? Patient having long-term diabetes mellitus which is uncontrolled usually land up with the complications like diabetic nephropathy, diabetic neuropathy, and it causes cardiac diseases. And diabetic food complications are the most common complications of long-term uncontrolled diabetes mellitus. How to recognize the diabetic food complications? The patient will have a long-standing ulcers, a abscess in the food, and the deformity of the food, and the gangrene of the toes. When will you call the toe is gangrenous? If the patient has a blackish discoloration in the toe, either in the tip or the old toe, or if they lost sensation in the toe or foot, or if they have any abscess with the pain in the foot, they have to come for a clinician. So what are the complications of diabetic food? The patient may land up with amputation. What do you call for the amputation? Amputation is just removing that part of the limb which is diseased. So we have to prevent the amputation. That is the main aim of diabetic food management. What are the precautions we advise the patient to take to prevent these complications? For example, if the patient lost sensation in the food, they have to get a sensitometry examination by a clinician. If they have any ulcer or any infection in the food, they have to get attention of a clinician. So when the patient come with these complications, ideally we take an X-rays or do a Doppler scan to see the vascularity of the foot. Then we just assess the infection status of the food. Depends on the status of the food, we manage accordingly. There are so many varieties of treatment for diabetic food, and in an early stage the treatment is very simple. We advise the patient a strict diabetic diet and a strict blood sugar control. What is the ideal goal of blood sugar control? See, patient has to control his blood sugar level, that is HbA1c less than 6 in the most of the months. Strict blood sugar control is a vital role in the management of diabetic food. So what we do if the patient has a gangrene? So if the patient has a gangrene, we need to remove the toe which is affected. If we don't remove the toe which is affected, that will spread accordingly. That will spread to the foot, that will spread to the limb, and if the patient or the clinician neglect, patient may lose his limb. That's why the early recognition of diabetic food complications are the most important aspects in a diabetic food management. So the patient has to examine his food regularly in front of mirror, and when the patient is cutting his nails, should be very careful to avoid the trauma. If the patient has any infection that is called intertrigo in between the toe, they have to take care of the infection with an antibiotic or antiseptic ointments. So if these symptoms recognized early, we can prevent diabetic food complications. And we advise the patient to wear MCR slippers to avoid the callosity of the food. The MCR slippers, that is called microcellular refined slipper, so made specially for diabetic patients to avoid the injury to the food, since the patient has usually the less sensation in the food. So that's why the diabetic food complication prevention is a very vital role in our surgical management of diabetic food. Thank you.